Wow. This is Healthcare Reimbursement and Revenue Cycle by Riker Evans, HIM 242. Overview of the revenue cycle. The healthcare revenue cycle is an entire process that starts when a patient first schedules an appointment and continues until the provider receives full payment for services. It's important because it directly affects the healthcare organization's financial stability and ability to provide care. This process isn't just about billing, it connects both clinical and administrative areas, meaning everything from accurate documentation to correct coding plays a role. Physicians ordering. Physician ordering is one of the very first steps in the revenue cycle. This is when providers such as doctor orders specific tests, procedures, or treatments for patients. These orders are what drive the rest of the process because they determine what services will be performed and eventually billed. If something is ordered incorrectly, missing information, or considered medically or not considered medically necessary, it can create problems later in the revenue cycle. For an example, insurance companies may deny a claim if the documentation doesn't support the services that was ordered. That's why accuracy at this stage is extremely important. It directly impacts coding, billing, and reimbursement. Basically, if anything goes wrong here, it can affect every step that follows. Inpatient versus outpatient care. In healthcare, patients are classified as either inpatient or outpatient, and this affects how many services are billed. Inpatient care means that the patient is formally admitted to the hospital and stays at least overnight. These cases are usually more serious and involve more resources. So they are billed differently, often as bundled payment based on diagnosis. Outpatient care means the patient comes in for service and leaves the same day. These services are usually billed individually depending on what was done. A simple real life example would be if someone goes to the emergency room for a broken arm and goes home the same day, that's an outpatient. But if they're admitted for surgery and stay in the hospital overnight, that becomes an inpatient. This distinction is important because it directly impacts how the providers get reimbursed. Patient registration. Patient registration is one of the first and most important steps in the revenue cycle. This is where all of the patient's basic information is collected, including their name, address, date of birth, and insurance details. During this step, the providers also verifies the patient's insurance to make sure it's active and covers the service being provided. Even though it seems simple, this step is extremely important because any errors like a misspelled name or incorrect insurance ID can lead to claim denials and delays in payment. Basically, accurate patient registration helps make sure the rest of the revenue cycle runs smoothly and that the providers get paid correctly. Patient registration form details. The patient registration form collects all the detailed information needed to properly identify the patient and bill for services. This includes demographics, information like names, date of birth, and address, as well as insurance details such as the policy number and insurance company. It also includes guarantor information, which the person responsible for paying the bill if it's not the patient. Additionally, the patient provide emergency contact information and sign important consent forms. These forms give permission for treatments, allow the provider to bill insurance, and ensure compliance with privacy laws like HIPAA. Primary versus secondary insurance. Primary insurance is the main insurance that gets billed first for patient services. If there are still costs left over, the secondary insurance is billed next to help cover those remaining charges. This process is called coordination of benefits, and it determines which insurance pays first. Having both type of Having both types of coverage can help reduce how much the patient has to pay out of pocket. Par versus non-par providers. Par providers are participating providers who agree to accept Medicare's approved payments amounts for all services. This means they accept assignment and patient usually pay less out of pocket. Non-par providers don't always accept Medicare rates and they can charge more, although there are limits on how much extra they can bill. So this difference mainly affects how much the patient ends up going is how much the patient's going to end up to pay. Accept assignment. Accepting assignment means the provider agrees to take the insurance company's approved amount as full payment. This is common with Medicare participating providers. When an assignment is accepted, the provider can't charge the payment more than what's allowed, which keeps costs lower for patients. So overall, it protects patients from being overcharged. Charge capture. Charge capture is the process of recording everything that was done for a patient during their visit. This includes procedures, tests, and any supply used. If something isn't recorded, it won't get billed, which means the provider loses money. So accuracy is really important here to make sure all services are captured and properly reimbursed. Encounter form. The encounter form, also known as a super bill, is used to document everything that happens during a patient's visit. It includes the diagnosis and the procedures that were performed. The provider fills this out and then used by coders and billers to create the claim. So this form is really important because it connects what happened during the visit to how it gets billed. Charge master and billing. The charge master is basically a master list of all services a hospital provides along with their prices. It used to make sure charges were applied consistently. There are also standard billing forms used to submit claims. The UB04 is used by hospitals, while the CMS 1500 is used by physicians and outpatient providers. These forms help make the billing process more organized and standardized. Coding and auditing. Coding is the process of translating what was done for the patient into standardized code. These codes are what gets sent to insurance companies for billing and reimbursement. Auditing is the step where coding is reviewed to make sure everything is accurate and follows regulation. This helps prevent errors, reduces risk of fraud, and makes sure providers are paid correctly. ICD-10-CM. ICD-10-CM is the coding system used to describe a patient's diagnosis or condition. It explains why the patient needed care in the first place. These codes are important because insurance companies use them to determine if a service was medically necessary. So without accurate diagnosis coding, a claim could be denied. ICD-10 PCS versus CPT. IDC-10 PCS and CPT are both used for procedure coding, but in different settings. ICD-10 PCS is used for inpatient procedures, mainly in hospitals, while CPT codes are used for outpatient services like doctor visits or minor procedures. Understanding the difference is important because using the wrong code system can lead to billing errors and claim denials. HCPCS Level 2. HCPCS Level 2 codes are used for items and services that aren't covered by CPT codes. This includes things like medical equipment, ambulance rides, and certain medications. These codes are especially important for Medicare and Medicaid billing. So while CPT covers procedures and services, HCPCS Level 2 helps fill out the gaps for other types of charges. Patient discharge processing. Patient discharge processing happens when the patient leaves the facility. At this point, all services need to be finalized and properly documented. This step makes sure the patient record is complete and ready for the next step in the revenue process. Accurate discharge processing is important because missing or incomplete information can delay billing and cause claim issues. Discharge planning. Discharge planning focuses on preparing the patient for what happened after they leave the facility. This includes giving instructions for follow-up care, medications, and any future appointments. It also involves coordinating with other providers if ongoing care is needed. Good discharge planning helps prevent complications and it reduces the chances of getting patient or it reduces the chances of the patient being readmitted. Billing and claims processing. This step is where all the information collected so far is turned into a billable claim. It uses the codes from the documentations to show services were provided. Before submitting, the claim is reviewed to make sure everything is accurate. If there are errors, it can lead to delays or even denials. So this step is really important for getting paid correctly. Patient ledger. Patient ledger is a record of all financial activity for the patient account. It includes charges for services, payments made, and any adjustments. This ledger is updated throughout the entire revenue process and helps track the patient's balance. It's important because it gives clear picture of what has been paid and what is still owed. Claim submission. Claim submission is when a provider sends the bill to the insurance company to get paid. Most claims today are submitted electronically, which makes the process much faster and more efficient. The claim has to include accurate information like patient details, provider information, and correct codes. If it's not submitted on time or errors, it can delay payments and even be denied. Clearinghouse. A clearinghouse is a third-party organization that acts as a middle step between the provider and the insurance companies. It checks claims for errors and makes sure everything is formatted correctly before sending them to the payer. This helps catch mistakes early and reduces the chances of the claim being rejected. Overall, clearinghouses help make the billing process faster and cleaner. Claims adjudication. Claims adjudication is when the insurance companies reviews the claim after it's been submitted. They check if the services are covered under the patient's plan and if they were medically necessary. They also review the claim for accuracy. After that, the claim is either approved, denied, or adjusted based on the patient's benefits. Payment process. After the claim is approved, the insurance company sends a payment to the provider. The amount depends on the coverage and the allowed amount. If there is any remaining balance, the patient is responsible for paying it. Once the payment is received, it's posted to the patient's account in the system. Remittance advice. Remittance advice, or RA, is a document sent from the insurance company to the provider. It explains how the claim was processed, including what was paid, any adjustments, and if anything was denied. Providers use this information to understand the payment and to correctly post it to the patient's account. Explanation to benefits, or EOB. Explanation to benefits is sent out to the patients by the insurance company. It shows what services were billed, what the insurance covered, and what the patient still owes. It's important to know that EOB is not a bill. It's just an explanation of how the claim was processed. Patients can use it to understand their charges and compare it with their actual bill. Denials versus rejections. A rejection happens when the claim has an error and it is not accepted for processing at all. A denial happens after the claim is reviewed but the insurance decides not to pay. Rejections are usually easier to fix and can be corrected and resubmitted. Denials are more complicated and may require an appeal or more documentation. Both delay payments, so avoiding errors is really important. Appeal process. The appeals process is used when a claim has been denied and the provider wants to challenge that decision. To do this, they submit additional documentation to support why the service should be covered. There are specific rules and deadlines that you have to follow depending on the insurance company. Sometimes there are multiple levels to an appeal, and the claim can either be approved or denied again. Patient billing. Um, Patient billing happens after the insurance company has processed the claim. At this point, patient is billed for any remaining balance like deductibles, co-pays, or co-insurance. The patient receives a statement showing what they owe and may have a different payment option. This step is important because it's often the final part of getting full reimbursement. Self-pay and collections. Self-pay refers to patients who don't have insurance, so they are responsible for the full cost of their care. Providers may offer payment plans to make it more manageable. If the patient doesn't pay, the account may be sent to collections. The collection process is used to try to recover unpaid balances. Accounts receivable versus payable. Accounts receivable is the money that is owed to the provider, either from insurance companies or patients. This is a major focus in the revenue cycle because it directly affects cash flow. Accounts payable is the opposite. It's the money the provider owes for things like supplies or operating costs. Managing accounts receivable well is important to make sure the organization stays financially stable. Delinquent claims and bad debt. Delinquent claims are claims that haven't been paid on, often due to errors, delays, or denials. These require follow-ups to figure out the issue and try to get payment. If the balance ends up not being paid at all, it may be considered bad debt and written off. This can negatively impact the provider's finances, so it's important to manage claims and follow up quickly. Cost control strategies. They're used to help manage and reduce healthcare costs. This is important because it keeps the organization financially stable and improves efficiency. It also helps make sure the only necessary services are provided, which avoids waste. Overall, control cost or cost control supports better use of resources and more effective revenue cycle. Utilization management. Utilization management is used to make sure patients are receiving the right care at the right time. It focuses on whether services are medically necessary. This helps control costs, preventing unnecessary treatments. Both providers and insurance companies use utilization management to improve efficiency and quality of care. Respective versus retrospective review. Retrospective review happens before a service is provided and it checks if the care is medically necessary ahead of time. Retrospective reviews happen after the service and looks back to evaluate if the care was appropriate and properly documented. Both types of review are important because they help control costs and make sure patients are receiving the right care. Concurrent review. It takes place while the patient is actively receiving care. It monitors the treatment in real time to make sure everything is medically necessary. If something needs to change, adjustments can be made right away. This helps control costs and also improves quality of care that the patient's receiving. Pre-authorization is when the provider has to get approval from the insurance company before performing certain services. This is done to confirm that the service is medically necessary. It helps control costs and prevent unnecessary procedures. If pre-authorization isn't obtained when required, the claim can be denied and providers may not get paid. Case management. It's about coordinating a patient's care across different services and providers. Focuses on making sure care is both high quality and cost effective. Case managers help plan, monitor, support the patients throughout their care. This helps improve patient outcomes and can also reduce hospital readmissions. What I found interesting. One thing I found interesting is how complex this cycle really is. There's so many different steps, and each one depends on one another before it. I also didn't realize how small errors like incorrect patient information or coding mistakes can lead to claim denials and delay payments. One more thing that stood out to me is how important documentation and coding are, since they are directly affects whether a provider gets paid. Overall, I found it interesting how everything is connected, and how both clinical and administrative roles play a part in this process. And here are all my sources for this. Thank you.